I'm your host, Dr. Rebecca Risk, and today we're going to actually talk about animal health. If you follow me on social media, you know that my weekly co-host is actually my dog, Oliver. He sits on my lap for every recording, and he's kind of involved in his own way, telling me kind of what's going on and where, well, not that involved, but he's there listening. And I realized that since we talk about human health, it's also important to talk about the health of our four-legged friends. So Oliver's favorite vet, who helped him become the healthy little guy he is today, is joining me for this show. And she opened my eyes to all the options that we have for these guys. There's so much a big part of our lives. Dr. Wanda Vockeroth graduated from the Western College of Veterinary Medicine in 1982. Welcome to the show, Dr. Wanda.
Thank you.
So I guess, the first question is just to know a little bit about you and what made you decide to become a veterinarian.
Well, I actually had a love for animals ever since I can remember. And as a youngster, we lived on a farm, and I had all sorts of animals, especially, cows and one or two dogs and a number of cats that, lived in the farm. And I actually sort of took it on to myself to be their caretaker. And, if they were sick, I'd be going to my parents and, saying, what can we do? And sometimes even helping my dad give injections and things like that. So it just kind of evolved from there.
So what made you start to incorporate the holistic stuff? I mean, you actually got involved quite early on, when probably a lot of people weren't doing, animal acupuncture and stuff like that. So what drew you to that?
Originally, probably the first thing was a client that I had probably a couple of years after I graduated from vet school, who had a dog with some very bad arthritis, and what we could do was offer, from a conventional basis, was offer just medications and things like that, anti-inflammatories and so forth. And at that time, they weren't as sophisticated as they are now, and her dog just could not handle them. They all made him very sick. So at one of the visits, she asked if it would be okay if she consulted her homeopath and see if the dog would improve. They could find something, and I had no idea, but it sounded safe when I read up about it. So she went ahead, and then a couple of months later, the dog ran up the stairs of the vet clinic, and that made me kind of think there's something here else I need to learn. And I guess that was my first interest. And then after that, just going to conferences where they offered seminars on acupuncture for pets and so forth, and that really caught my interest. And after that, off I went to a course.
I think that's how all of us kind of get involved in this kind of thing. We're, kind of thrown into it, or somehow it comes on our way, and we find it really interesting. And I like the fact that there's other options. I mean, I want other options for myself. And my assistant said to me today that until I had mentioned it to her, she didn't realize that our animals had other options either. So,
exactly.
It's nice that there are people that do that. So how exactly do you choose what to do for these guys? I mean, they can't really tell you what's going on. So how do you figure that out for them?
Sometimes it's pretty obvious when an animal comes in. If, for instance, they have, a chronic arthritis or something like that, then it's going to be, there's certain options to use for that. Or if they just, say, slipped on the ice and it's a very acute problem, and they just have, say their neck is sore or something like that, then, at that point it's fairly easy to see that they need some kind of manual therapy, some, osteopathic therapy or something like that. And otherwise, then sometimes it's just there are a number of options available, and that should be useful. And just from experience, and then discussing with the pet's owner what things they would like to work with, we decide from there what to use.
So, what things do you do that's different than what other veterinarians do?
Well, I offer a number of therapies that are considered alternative. They aren't, normally used by or normally I guess, used by vets, or they aren't vets. The conventional vets aren't trained for these things unless they go seeking for them. So things like acupuncture, and then some manual therapies like osteopathic and craniosacral therapy. And then herbs, both Chinese herbs and Western herbs. And then I also use homeopathy, and really I spend a lot of time talking about diets with the pet's owners.
I mean, that's interesting, because I don't think a lot of people think about that. When I first came to see you, I was I didn't have Oliver at the time. I was giving my cats a formula that I was getting from the vet, but you pointed out that it had gluten in it. And when I switched over, my cat had a significant change in her health. And I don't think we think about that kind of thing. We're all sensitive to some of these things, and we don't realize, the animal's food has these issues too.
Mm-hmm. And it turns out that a lot of animals have dietary sensitivities, just like you said, just the way people do. Many more so than you'd normally suspect, and many more than I originally thought of. But it's actually quite a common thing.
So probably as common as people are.
I think so.
Yeah. Do you recommend like the raw food for animals if they can tolerate it?
That is actually one of the things that a lot of my clients go forward with. Yes, I do actually. It really depends on the pet and their stage of life and so forth, but definitely either raw diets or homemade, sometimes cooked diets are often, first off, much more palatable for pets, but also in the long run, a lot of them very obviously do better on them once they've started what their owners have started them on them for a while. You just notice changes in stool quality and coat and energy and all sorts of things, actually.
That's pretty interesting. I suppose that's what they're supposed to eat. I mean, I think when my cat catches a mouse, she certainly doesn't cook it first.
Yep, so that's exactly right. Or run it through a processing machine.
Yeah, and then put some corn and some wheat in there with it,
exactly.
Right? You mentioned you've seen some changes in their coat. So when you're doing all these different things, before you did these things, I think you had about 10 years in between just doing regular veterinary and then doing these different things. Did you notice a lot of changes?
I did, actually, and that's one of the things that convinced me. I actually hadn't thought about using non-processed diets until after talking to vets, some of the courses I was doing for acupuncture and so forth, and they just said that, well, that's one of the things that we routinely recommend for our clients. And so when I, did a little bit of reading on that sort of thing, I thought, well, it's worth a try. And so some pets, for instance, that had serious chronic digestive issues, and none of the commercial foods, even the prescription diet, seemed to help them out. I thought, well, why not try this? And I would see them literally improve in a week, where none of the other diets seemed to do any or help them at all. So that was what convinced me to start with. And now, over time, and at this point, I've probably been recommending these kind of diets for probably almost 20 years now. But I see over and over such change, such improvements in the pets that I'm firmly convinced that feeding more natural diets do help them.
It makes sense. That's where, when I'm treating people, that's where I start, is with their diet. And then you see what changes, and maybe you have to do more, but maybe half the symptoms go away. So it's important. Yeah. Now, along with changing the food, though, do animals need things like probiotics like we do?
Some definitely do. Some can get away without them. But I always kind of talk to people about looking back at how, animals, as you were saying in the wild, how they would normally, or what they would normally eat. And, even cats and dogs, both their, predecessors would catch their prey, and they would eat pretty much all of it, including the stomach and intestinal tract. And those actually mice and rabbits and so forth, when they eat, well, what they're eating is veggies, but they're digesting them down, so they're broken right down. But animals are eating a little bit of that, but they're also getting the enzymes from the stomach and the intestines, and also the probiotics that are formed. So that's part of their natural diet. I do see a number of animals do quite a lot better as far as their digestion, for sure, if they are given probiotics on a regular basis.
And you said digestive enzymes as well.
Yeah, and animals make their own, and actually if they're being fed raw food, the meat actually has some digestive enzyme in it. So a lot of animals don't need any more than that, but actually some it does turn out that it helps them a little bit more if they're given digestive enzymes as well. So
they might be like us, where as they get older, they're just producing less and might need a little bit of help.
Yes. Yeah. That's true.
Yeah. That makes sense. So while we're talking about digestion, we recently did a parasite cleanse for my cat. She had never done one, and she was throwing up a lot. And that actually helped her. And not only did she stop throwing up, but she's slightly less cranky, although Oliver could tell us right now that she's pretty cranky because she doesn't like him. And recently it gave him a scratch in his eye. But do you see parasites and worms and stuff a lot in animals?
It's off and on. I mean, actually, as it turns out, most puppies and kittens have them, and the worms we see in our area primarily are the intestinal worms turn out to be roundworms or tapeworms. Animals that hunt, like cats that hunt, will pick up tapeworms pretty readily. And otherwise, with the roundworms, those are more common in young animals, but sometimes we'll see them in adults as well. So, it just depends on how they're doing. We don't deworm animals, monthly or anything like that. I think it's not necessary to do it that often, and I don't like giving them that much in the form of chemicals and things. But we kind of, for adults, go case by case.
Yeah, it made a big difference for her, so I'm glad we looked at that. Mm-hmm. And when we're talking about digestion, of course, is there something that's normal with our animals' poop? Like, should they be going, once or twice a day like us?
Yes, it's probably 2 to 3 times is pretty normal for dogs and cats. Their digestive tracts are much shorter than ours, actually.
Okay.
And so, so probably 2 to 3 is pretty normal. Up to 4 is okay. Anything more than that is a little bit abnormal.
Okay. Digestion is always the first thing to look at. So we've talked about that. We're going to take a quick break. We're talking today with Dr. Wanda Vockeroth. She is actually a holistic vet, and she's the vet to Oliver, who is my co-host with every show. He's with us today, and he's listening. He's pretty excited because he knows Dr. Wanda's voice. So he's looking around, wondering where she is, because he just saw her a few weeks ago. So host Dr. Rebecca Risk, and today we're talking with Dr. Wanda Vockeroth. She is actually the vet to Oliver, and if you follow me on social media, you've seen Oliver sitting with me during my recordings. He actually insists on being on my lap during the recordings, and he sits the whole time. So he's become a very wise dog listening to all these shows. So Dr. Wanda, you do a lot of different therapies, and I know osteopathy is one of yours. One of, the main ones I see you do that every time we go in, you give them all a check over. What exactly is that, and what does it do for them?
Osteopathy is actually sort of a form of very gentle manipulation, which can do quite a bit to relieve tension in the muscles and ligaments, and even in the joints, for that matter. Actually, osteopathy overall, it's kind of different in different countries, but in Europe, where it kind of has its main, a lot of people use it more or less. It actually is really around very gentle and subtle manipulation techniques to just help release the tensions in your body. And actually, it can also be used for some organ problems, for even like scarring after surgeries and things like that. And they call that visceral manipulation. So and it's been used in people for almost 200 years now, but just more recently it's become something that veterinarians are starting to learn.
Well, it was really interesting when you did it to my cat. She is a little bit bow-legged, and afterwards she was about, 8 at the time, and she does go outside, and she actually caught her first mouse about that week, and I think that she was able to like jump and lunge better, because I noticed she was jumping off the furniture a little easier than she ever had. Although she doesn't like limp in pain or anything like that, I think it made her more comfortable and made things better for her.
Mm-hmm.
So
yeah, that's pretty common actually. To see animals just be able to move and as you say, jump and stretch better.
Yeah. So I think we all need a little bit of help. So it's nice the animals are getting that too. Mm-hmm. What is craniosacral?
It's actually osteopathy and craniosacral therapy are somewhat related, and it's almost like osteopathy is almost like the main kind of umbrella, and then under that, basically I'll put it this way: when I took my osteopathy course, we actually learned things that were kind of like chiropractic techniques, and everybody pretty much knows what chiropractic is, where you actually get manipulations of the joints themselves. And so we didn't learn about that. We also learned these craniosacral techniques, and craniosacral therapy is actually really started around the fact that it turns out the bones of the skull aren't actually fused. They babies, obviously they're not fused because the skull has to grow, and there's these little joints called sutures between the bones. Well, we used to think that when you became an adult, your bones all fused, but it turns out that they don't. They actually still move a little bit, and they can actually become kind of stuck or jammed together, especially if you hit your head or something like that. And so originally, once that was discovered, then they decided to see if there was ways of relieving that tension, and realized there's actually a rhythm in the fluid in the head. It's called the craniosacral fluid, and if you kind of follow the rhythm, and you can actually use that to help basically relieve things like the tensions between the bones. Sounds a little odd, but it's almost like you get a very subtle touch. You can feel those rhythms, and by doing that, sometimes the rhythms are disturbed, and you can almost like gently manipulate them, and then that actually helps the tensions in the bones. And then they discovered it wasn't only the tensions in the bones that you could help, but it was into other tissues of the body and other bones as well, including the sacrum, which is the big bone right at the end of your spine. Basically, you kind of sit on. So anyway, overall, turned out, and then more and more people or therapists started using these techniques and discovering, kind of developing them and discovering other ways to use them, and then that's almost branched out into some of these other techniques that are used in osteopathy as well. So it like I say, they're all kind of interconnected, but the craniosacral itself is a very, very subtle touch, and you animals actually accept it really nicely, just because there's not any really force involved with it.
So what changes do you see when you're using it?
Basically, they're, again, it in most cases pretty subtle, but a lot of times when I use the craniosacral, it really is on problems in the head and neck area. And for instance, I'll give an example. Just about a month before Christmas, had one of my clients who brings her pets to me, but she fosters dogs as well from the rescue organizations, and she brought in a dog that was about 9 months old, little female, and she, when she came, she had 2 broken legs and actually a fracture in her skull, but she was pretty alert and so forth. They decided to see what they could do to help her out and fixed her legs, and they were fine, but then she started to have seizures. And so she was already on 2 medications, and yet she was still seizuring. So I started to check her out, and I realized that there was a lot of compression in her skull. In fact, her cheekbones, they call them the zygomatic bones, were actually crooked. And so I decided to try and use the craniosacral technique and to see if I could help relieve some tension. And sure enough, there was some changes. And this dog sat very quietly while I was doing that. And so it took about 10 minutes. And then after that, she was like, well, I think I'm done now. And it felt like she'd kind of moved through what she needed to. And so when I rechecked her cheekbones, they were now even. So there had been quite a bit of subtle shifting. And actually, then she came, I asked her to come back a month later, and she came back. The dog had not had any more seizures, where she was actually having at least 3 per week before that. So it actually made quite a change in her.
Yeah, that's a pretty powerful story. And the lucky dog that they found you. Nobody wants to have seizures, and you just did this little treatment, and that's pretty amazing, actually. Mm-hmm. So, one of the other things you do is homeopathy. And how do you use that with animals? I always find homeopathy, I've taken courses, and I have some, I'm a herbalist at heart, so I have some trouble with it. But how do you figure the animals out with that?
Well, to start with, in case, maybe your listeners already know this, but I'll quickly say that homeopathic remedies are actually made using herbs and minerals and things like that. But what they do is they take a little measured amount of that, grind it up, and then dilute it with a certain amount of water. But then they actually start to do a special kind of mixing called succussing and diluting of this herb until eventually there's basically none of the original thing left. But then it works on a sort of an energetic level in the body. And so the way you pick them is by, they say, like cures like. So, for instance, if you have an animal that's got, vomiting and diarrhea, you would actually look for a remedy that originally would have caused that. But now, because it's in a different form, it can actually give the body a subtle push to almost kind of get itself back into balance. And so, again, they say like cures like. So what we do is we look at the symptoms of that the animal's showing, and then try and match up a remedy that's going to work, and then that's given orally. It is a bit more of a challenge in animals than people, because a lot of the symptoms, the dog can't say, well, I have a real kind of a weird pain in my lower abdomen. So you have to just go on what the owner observes and what I observe when I'm seeing the pets. And so it can be a little bit trickier to find a remedy, but in some cases it can be fairly obvious, and I've seen it make quite a difference. And that's interesting because, of course, animals can't think that they're getting something that's going to make them better, and then they feel better because of that. So
there's no placebo effect with the animals.
Exactly.
Yeah. So which is interesting. I mean, the reason why I came to you was for my cat, and we did a year of homeopathics, and her issue finally resolved, and not it was an obscure thing, but it helped her. Overall, she's a pretty grumpy thing, but I think her demeanor changed. She'll always be a little grumpy, especially with Oliver around, but her demeanor changed a little bit, which was, nice. I think it must have given her relief, because when we're grumpy, I think we're grumpy for a reason, and uncomfortable for a reason. So I found those really helpful. Now, you use the Bach flowers as well, and you do those on a different, maybe just explain what those are. They're a little different, I think.
Yes. So Bach flowers were actually originally discovered by a fellow named Dr. Batch, Edward Batch, who was from, or Bach, I guess, who was from England. They're used for people, and they're actually made from flowers, like the flowers of different trees and plants. And what he would do is pick the flowers and then actually soak them in alcohol, get the essence of them that way, and then that would be the basis of the remedy itself. And so then what you do is take that and actually dilute it, like put it in, for instance, a few drops in a glass of water, and then that is the remedy is, basically diluted is how it works. And they're actually originally meant primarily for sort of emotional problems, anxieties, and sadness, and various things like that. But they actually can also help in some cases with some chronic illnesses and so forth as well. And so I use them a lot for animals that have anxiety issues, again, if there's been some kind of a loss in the house, another pet or something like that. But also as support when they're coming through chronic illness, or maybe after trauma or surgery or something like that.
Yeah, Oliver has a lot of separation anxiety just because he was adopted by me as an older dog, and that I think that's hard to change owners. And he's happy now, and it's getting better. But what would you recommend for separation anxiety?
Back flowers actually can be fairly useful. And how I normally pick them is actually have the owners themselves pick them, because there are 38 different back flowers, and they all have their own characteristics. So what we do is we've developed a kind of a handout that has all these written down. And what I do is have the owner take it home and go through it and see which ones fit their pet, because obviously they know their pet the best. And then they'll usually pick out 6 or 7 of these, and we carry them. So then we have people call in, and we make up the remedy, and they can take it off home and try it out. So back flowers are helpful. Again, sometimes homeopathic remedies, but there are a number of different things. There's something called Adaptil, which is actually a kind of a pheromone spray that you can use, which is a calming spray. It's actually made from a substance that mother dogs produce from their skin when their puppies are nursing. And they discovered that happened. They discovered the biochemical properties of that, and they figured out how to actually make it artificially, and it can be quite helpful actually. So those things, and sorry.
You recommended something similar when I first got Oliver for the cat, because she was having some adjustment issues.
Right.
And I got her one of those collars, and I swear she looked like she was stoned when I first put it on her.
Really calmed her down.
Yeah, she was a little different that day, and it wore off eventually. Went to wear off a little bit, but I think it helped her. I went through 2 of them as she was adjusting to Oliver being around, and it was a little easier for her. We're going to take a quick break. We're speaking today with Dr. Wanda Vockeroth. She is the vet to Oliver, who, if you follow me on social media, is my co-host. He sits with me listening to every show, and he's listening today, and very excited to share his doctor with you today. So we're going to be back shortly. If you have any questions, feel free to email. And I'm here today with Dr. Wanda Vockeroth, and she is the vet to my co-host, Oliver. Oliver sits with me for every show, and if you haven't seen him on social media, find us on Facebook, and you can see some of his cute pictures. He insists on being on my lap. He's with us today, and he's listening intently, and he's so happy that you guys are all listening to find out how you can help your own furry friends at home. So, Dr. Wanda, one thing, of course, that's always a concern for me is, ticks. I had a cat that did get Lyme disease from ticks in our backyard, and that was before Lyme was. It was actually the month that I was waiting for my Lyme test to come back, so I hadn't done anything to prevent, ticks or anything like that for them. What do you recommend for people for that?
Well, there are some various options in areas where it's maybe, not quite as prevalent as others. There are natural remedies that you can use to basically put on topically on the body to help repel ticks. It's really important to just examine your pets, ideally every day, and just make sure that there aren't any ticks there. It does take a little bit of time for them to transfer the Lyme. I mean, I'm sure your listeners know all about Lyme disease, or quite a bit about it anyway. But yeah, so just making sure you're examining them, taking anything like that off that you find. And there are some homeopathic remedies that actually can help pets as well. Basically, if it turns out they do pick up Lyme disease, but it's still again fairly new to the population of Alberta, at least the realization that it's around. So, what I do, I think one of my most important duties is to just tell all my clients when they come in that this is something that's a definite possibility now.
Well, I think that in Alberta, Lyme was first found here by a vet who found it on a dog. And then that's when they realized, that they had to start doing studies. So there's a study now in progress to find out how prevalent it is. So hopefully it's not as bad as we want, but, halfway through the study, they did say it was 1 out of every 4 ticks. So it's, probably a little more than we think, but.
Yeah, wow.
We don't know yet. We'll find out, I suppose. But it's good to know there's something that we can do, and we have to be aware for our animals' sake, because they can get Lyme as well. So, one thing as well that's really common as our pets get older is, of course, pain, arthritis, joint issues. What do you recommend for that?
You're right. It's really common, and so if I can actually start by trying to have owners do some prevention. So for dogs particularly, especially the big ones and active ones, even around 5 or 6 years of age, if I can, I'll start having people use essential fatty acids like omega fatty acids, such as krill or salmon oil in their diets, because those are quite useful for protecting the joints as well as helping with skin and other parts of the body. And then also starting on some kind of a joint supplement. And I do find that the glucosamine and MSM combination is really quite helpful in most cases. And then as they get older and start to have the issues, definitely if they haven't already done it, to use those. There are other ones as well, and so if we measure or just have the owners watch and see how much those supplements are helping, and if they don't seem to be helping enough, then we may add different supplements in, or try other ones such as green lip mussel extract or something called cetyl myristoylate. These are all supplements that actually do help with joint inflammation and help the joint fluids and things like that.
So you're saying around age 6 to start doing that, or even sooner, I suppose. I mean, all those things, it could be just good overall.
Yeah, and then good diets, and again, so many animals turn out that they actually have either very strong or else very mild reactions to things like wheat and corn and so forth, like the gluten sort of problem. And so, if I can, if the animals are still on those sorts of foods, get them to change into something else, because even those, if there's inflammation in their body, it'll affect the joints. And if you can change your diet and decrease the inflammation, it'll help the joints as well.
So, one of the main things when I got Oliver, he had a lot of problems when I got him, but he used to choke. He said that it was his trachea, and to put him on some similar things to what you just mentioned, because it's very similar to the joints. And I actually didn't have to. He had to undergo surgery and get an infection out of his mouth, and then by changing his diet, he stopped choking as dramatically as he used to choke all the time. And that was such a big difference, just to change his diet and get him as healthy as I could without. I wanted to see without supplementing how he would do, and he's doing way better.
Mm-hmm. Yeah, it's amazing kind of differences that can happen.
Yeah. So, one of the main things when Oliver did come to me, so he was a KGG rescue, and I was told he had just been to the vet, but after I took him, it was obvious he hadn't been. And when you took him over, his teeth weren't doing very well, and he lost 23 of them. And, that major infection was causing him a lot of health problems. But of course, there must be things that could have been done if he had had better care to prevent him losing so many teeth. So what do you recommend for people for that?
If possible, start them as when they're puppies and brush their teeth. I mean, brushing teeth really can do as much good for pets as it can for people. Unfortunately, even starting as puppies, a lot of dogs and cats are pretty resistant to that process, and also it takes quite a lot of dedication, because you really need to do it either every 1 or 2 days to actually keep the tartar from forming. Another thing that actually can help a lot is having especially the dogs chewing on some kind of fairly hard toy or something like that. In fact, the thing that seems to work the best is having them under supervision chewing on actual bones for 15 or 20 minutes every 2 or probably 3 times a week is good. There are, some things you have to watch for with that, including that they don't chip teeth, and also that they, aren't chewing pieces off the bone and swallowing them, kind of thing. But most dogs are, once they have tried it once or twice, they get pretty smart about the chips of bone. And I really see that dogs keep their teeth cleaner longer, and therefore need less dentals, and just overall the health of their mouth is better.
Which is important. No one wants to lose. He only has 5 teeth on the top, so he actually can't chew on those bones anymore. He tries, but he usually just licks them because he can't get that, and I'm sure if he'd had better care, he wouldn't be in that situation. But he does what he can. He's pretty smart. So,
yep. That's the problem when they get to the point where the teeth have to be taken out. Then, it's possible. Start them when they're younger and the teeth are better.
Yeah, exactly. Which is what this kind of care is all about, is preventing these major issues going on, which is also what I try to do for my patients is don't get a disease, don't go down that road, take care of yourself and take care of your animals so that, you live longer and healthier and happier.
Exactly.
So I know allergies are really common. We've talked about food allergies, but I know, dogs and cats can get other types of allergies. What do you do to help them with that?
So there are actually a whole number of different things that can help out. And, at least I would say probably 60% of the pets that come to me with chronic allergy problems, there is some involvement with diet. So that's the first thing we deal with. And after that, some of the other options that can help, basically, it's to decrease the inflammation in the body and balance the immune system so that it's not quite as reactive to the environmental things that are bothering the pet. So we use acupuncture, Chinese or Western herbs. There's other supplements that are, for instance, antioxidant supplements that can help. And also, in some of the cases, we'll work with homeopathic remedies, which basically just, again, helping to balance the pet system, and then they just handle things better. And again, I'm sure a lot of your listeners know about this, but a lot of the problem tends to be where there's buildup of toxins in the system. So if we can, we're also helping to detoxify the body a little bit.
Which is important for everybody. They're exposed to the same things we are in our environment, the pollution and whether we paint or renovate our house or that kind of thing. And they probably have the same, issues we do dealing with them. So,
and they're walking around and all over the place in the, residues and things like that, and getting them absorbed that way too, which is, hard to stop.
Yeah, they don't have that idea that they shouldn't be doing that. Mm-hmm. When I painted my house, I think Oliver ended up with all the colors on him because he kept, brushing against walls and stuff. So he was yellow and blue and, white and everything. It was pretty funny, actually. I don't know how he got it on his whiskers, but he must have been sniffing something. So I know one thing that people are always concerned about as their animal gets older is when they get cancer, which is pretty scary, whether it's your animal or you. Is there anything you can do to help with that?
Pretty much a lot of the same things. There's a number of supplements and herbs that actually can help, first off, to help the body, control spread of cancer, or ideally even kill off the cells. And then also there's different homeopathic regimes. There's a couple that we use that are kind of adapted from people. One's the Ramakrishnan protocol, and other one's called, various protocols actually, and then some East Indian homeopaths that their last name is Banerjee, and they've actually developed some different things. So veterinarians have kind of adapted that for animals, and I've had some quite good results using those sorts of things. And then, again, diet, because cancer cells, there's research showing that their main source of fuel is the carbohydrates. So basically, cutting back the carbohydrates and making sure they're on very, good nutrients in their diets. So that's the main things that we use, and sometimes it's just to support the animals through surgeries and things like that as well. But whatever sort of an individual call for each pet.
Yeah, I mean, cancer is different for every situation. So whether it's they're just having surgery, or do they go through chemotherapy as well?
Mm-hmm. Yep, there's actually a couple of clinics in Calgary that have veterinary oncologists and that can offer that sort of thing for pets as well.
Yeah, and that's never easy for anybody. So I can imagine not so easy for them either. So any kind of support is helpful. Now, one of the reasons why I sought you out was because my mom, who lived in a different city, her cat had a thyroid and kidney issues at the same time, and she's actually given it probably about a month to live with that combination, and she wasn't doing very well. She was pretty uncomfortable, and so my mom found somebody who did homeopathics, and I believe the cat lived over a year past that. Maybe two. I should have checked with her, but it was pretty amazing because the vet said, originally this cat has no time, and she was pretty spry. She was running around, and she kind of has some bad times, and I think it's pretty amazing that we can, it was more about making her comfortable at the time. Mm-hmm. And they didn't think it would extend her life. They just wanted her not to suffer. And, it was amazing. And I know that, thyroid issues are really common with cats. Do you do something similar for them?
Yes, and it's, usually, again, back to diet. But with thyroid, it turns out that, cats that have hyperthyroidism actually have developed benign tumors in their thyroid glands that produce more thyroid hormone than they need. But they're pretty hard to actually eradicate. But there are ways of dealing with it so that they're not producing quite as much thyroid hormone for quite a period of time. So homeopathic remedies and herbs are actually quite helpful for that.
Well, that's pretty interesting because it wasn't mentioned to her at the time, but it makes sense that the thyroid's just not. It's not working, right? Mm-hmm. So now diabetes is quite common as well. I've heard of some people giving their animals insulin shots as well.
Mm-hmm. Yeah, it's actually very common in cats and quite common in dogs as well. And in cats, the interesting thing is that there's research now that shows that probably if you catch it quite early, 70% of cats with diabetes will go into remission from that. Just go back to normal if you change their diet and onto a low carbohydrate diet. The cats just don't handle the carbohydrates very well, and so the grain-free diets and things like that, or non-processed diets. But in cats that turn their pancreas is just too weak and they need insulin, then certainly herbs for sure can help them, and also homeopathics can help. I actually had a cat that was diabetic for 6 years, and his insulin requirement went down from 10 units down to 2 after I started him on some herbs.
Wow, that's pretty amazing to hear that. So now, with talking about all of this, is there any signs that people need to look at with their pets that that their animal needs to go in to see a vet? What are the things they look out for?
Basically, any changes in energy or activity or attitude. So, if they start becoming lethargic or hiding or anything like that, or as with the cats with thyroid, if they start to be almost more hyperactive or restless, in their behavior. So any changes like that. Also, if their weight changes, either they start losing weight or gain more weight than they should, even though their diet hasn't changed. That you can see with actually low thyroid in dogs. So those sorts of things as well. And then certainly if they start eating less, just their appetite decreases, if they start drinking excessively, and then also for urinating and stool, if those changes, or those change, I should say, then those are all signs that there's something going on, and the pet should probably be checked over.
Okay. And how often should just a regular checkup be? Like a year? Is it every year or 6 months or?
For animals that are young and middle-aged, once a year is okay. Bearing in mind that with the length of pets' lives, I always tell people 1 year for a pet is like 5 years for a person. So for sure they should be checked every year. For the older pets that are now seniors, 9, 10 years and up, it's not a bad idea to have them checked every 6 months. And that's just because, again, more things can start to change and go wrong in their bodies as they get older. And it's still, relatively like a couple of years in that case between their checkups, right?
Yeah, and as you said, if you catch things early, you can, control them more and prevent them from getting worse. Just like if somebody had cared for Oliver a little better, he probably would have more of his teeth.
Exactly.
So, now, is there a way that anybody can get a hold of you if they have any questions or want an appointment?
Yes, I work in Calgary in the South End, and it's Millrise area, and I work at the Little Creek Veterinary Clinic.
And okay, that's great. So, do you have the phone number or the email for there?
Yeah, the phone number is here. It's 403-452-2060.
Okay, great. So we were talking today, Dr. Wanda, I want to thank you for coming on the show, and Oliver thanks you. Is really happy that you were able to tell everybody how to help their little furry friends at home. So thank you.
It was my pleasure. Thanks, Rebecca. That was great.
So everybody, today we were talking with Dr. Wanda Vockeroth. She is the vet to Oliver, who is my co-host for every show. He sits on my lap and listens intently to everything we're saying, and he wants to thank you for sharing this show, and is really excited that you got to hear his vet speak. If you